After you had your successful tummy tuck surgery, your post-op journey starts. Why your hospital stay is important. While in the hospital, there are several advantages to consider that can greatly benefit patients. One of these advantages is assistance with early ambulation, which involves getting up and moving around. This not only helps stimulate deep breathing and lung expansion, but also aids in the overall recovery process. Additionally, the use of incentive spirometry and sequential compression devices can further enhance these benefits. Another advantage of a 23-hour hospital stay is the immediate attention provided in the event of a post-operative complication. In addition, the hospital offers state-of-the-art laboratory and radiographic equipment, which are essential in diagnosing and treating potential complications. Furthermore, the hospital environment allows for more effective pain management through intravenous administration, which may not be readily available outside of the hospital setting. This ensures that patients are provided with optimal pain relief during their recovery. Finally, the presence of diagnostic equipment and specialists in the hospital is crucial in diagnosing and treating more serious complications, such as deep venous thrombosis or pulmonary embolism, in a timely manner. By considering these advantages and the comprehensive care provided during a hospital stay, patients can rest assured that their well-being is a top priority. Transfer to the surgical floor. Upon arrival to the surgical floor, patients are typically positioned in a reclined posture. At this stage, they may be offered ice chips or clear liquids before transitioning to a preoperative diet. Pain medication, anti-nausea medication, antacids, and possibly antibiotics may also be administered. To prevent respiratory complications, the use of an incentive spirometer is often encouraged to promote deep breathing exercises. Nurses assist patients with ambulation to minimize the risk of complications such as deep venous thrombosis and pulmonary embolism. Sequential compression devices, in the form of pneumatic compression socks, may be applied to the lower extremities while the patient is in bed to further reduce the risk of DVT and PE. The surgeon may choose to keep the Foley catheter in place for postoperative hydration monitoring, which is typically removed when deemed appropriate. Postoperative administration of blood-thinning medications may also be prescribed. In certain cases, patients with a high BMI may be discharged home after careful monitoring during the recovery period, at the discretion of the surgeon and following discussion during the consultation. Factors considered include the patient's medical condition, activity level, and surgical requirements. Hospital discharge. What to expect after surgery. Before you can be discharged from the hospital, certain criteria need to be met the day after your surgery. Throughout your hospital stay, your surgeon will closely monitor your vital signs, including temperature, blood pressure, pulse, and breathing rate to ensure there are no complications. We will also observe the amount and characteristics of your urine to ensure proper hydration and monitor fluid drainage from any tubes. The Foley catheter will be removed the next morning, and your diet will gradually return to normal. During the postoperative evaluation, your surgeon will assess and manage your pain and nausea. Once you can eat a regular diet, urinate, and walk comfortably with adequate pain management, you'll be ready to go home. After your discharge, your surgeon may have already prescribed medications for you prior to discharge. This ensures that you have pain relief readily available. The specific type and dosage of pain medication will be based on your medical history, past experiences, and local regulations on controlled substances. It's important to have these medications on hand without any delays. The hospital and your surgeon's office will typically provide you with written discharge instructions. You might have already scheduled a follow-up appointment with your surgeon prior to the operation or received instructions to call and schedule one. Traveling to and from your destination can pose challenges depending on your mode of transportation, so it's wise to plan for a comfortable journey. Ensure a smooth recovery with comprehensive postoperative guidelines and convenient travel arrangements. After reaching your destination, it's crucial to understand that this marks the beginning of a new phase in your recovery. Owning your recovery. You'll now be responsible for various aspects of your recovery. These include diet, hydration, activity level, drain care, dressing care, daily hygiene, and medication schedules. If you have any queries about these matters, direct them to your surgeon or their office staff. Relying on your plastic surgeon for postoperative information is vital, as opinions from social media, friends, family, or other physicians may not supply the correct answers. Seek guidance from your surgeon to ensure proper treatment and continuity of care. If your post-operative treatment requires involvement from another specialist, ask your surgeon to initiate or explore those options. Throughout your journey, the accessibility and support of your plastic surgeon play a significant role. Feel free to ask questions and obtain the necessary feedback for a seamless recovery. Your first post-operative office visit. This is a significant milestone in your recovery process. During this visit, your surgeons will assess your wounds, examine the drains, and check if you have been following your medication regimen, staying active, and keeping to a healthy diet with regular bowel movements. They will also supply guidance on using the compression garment correctly, allowing you to take a refreshing shower while protecting the drains. Remember to always wear the compression garment after bathing. This visit will reveal the initial results of your surgery, giving you an opportunity to see the outcome without any dressings or bandages. Remember, this is an initial evaluation of the results. 3 to 6 months of healing is necessary to appropriately evaluate results. Your plastic surgeon and their team will be there to support and guide you throughout this journey. Trust them for the best post-operative care and a successful recovery. Follow up for future office or virtual visits. Follow-up visits can be scheduled either in person or virtually. Your surgeon will closely watch your progress in the upcoming weeks, paying close attention to the appearance of the incisions during subsequent post-op visits. They will carefully check for any signs of infection or wound separation, dehiscence, and evaluate the drain output to decide the optimal time for their removal. Based on these findings, any necessary recommendations or changes to the treatment plan will be made. It is not unusual to see areas of redness or localized swelling that may require specific treatment approaches as determined by your plastic surgeon. Plus-size tummy tucks may have specific complications to be aware of. We look out for wound dehiscence, infection, skin necrosis, hypertrophic and/or keloid scarring. Seromas, fluid collections under the skin, can also impede healing. If any issues arise, consult your surgeon for a personalized treatment plan. This may include antibiotics, wound debridement, specialized wound care, aspiration of seromas, or drain replacement. Promptly communicate with your plastic surgeon if you experience serious complications like DVT/PE. Discuss signs and symptoms of these conditions with your surgeon before and after surgery to ensure optimal care. Watch the next video about your recovery timeline.